Hello again, many thanks for joining us. My name is Ernest Minu. Let's settle for the details now. Health experts in the Ashanti region say they are seeing increasing anxiety disorders and depression, especially in young adults, linked to the fear of COVID-19 as Ghana continues to see a surge in cases. They reveal many of young patients have conditions stemming from fear of contracting the virus and losing their livelihoods. Ohemin Terry of our health desk has more in the following report.
Meet 24-year-old Frida Ejay. She is among many young people whose social life has been affected by the fear of contracting COVID-19.
My name is Frida Ejay. I am 24 years old and I live in Kumasi. I'm a service personnel. Recently, there's this COVID-19 issue. It's very, very, very scary, especially for me. Even the name causes panic to me. It has affected my personal life, social life, and even work life, to the extent that I can't even sleep, I can't eat well.
Unlike many others who are seeking psychological care, Frida is not. She hopes to wake up one day to see COVID-19 disappear.
Right now, we are hoping for a cure. If there is a cure, we know that there is hope. If not, I don't really know what to do.
Ghana has, as of Thursday, June 4, 2020, recorded 8,885 COVID-19 positive cases with 38 deaths. Ashanti region has seen its cases rise in recent days to 1,452 with 17 deaths. Out of the number, about 1,000 of the infected are between 10 and 39 years. Doctors say the trend is inspiring fear, which is affecting the mental health of many young people like Frida.
When we recorded our first 2 cases, in fact, I was really scared. That day I didn't come to work. I was sleepless.
Those who do not already have mental health issues have started having mental health issues. Just the direct effect of the COVID. The majority of them come with anxiety issues.
At the specialist psychiatric unit of the Komfanoche Teaching Hospital, doctors say they are seeing more COVID-19 mental health related cases. Daily reported cases have shot up from 10 to about 30.
Those who already have diagnosis, most of them are relapsing, and for various reasons. Some of them are afraid to come to the hospital setting, to even come for their regular reviews, because they believe that the hospital is a front line. It's where the COVID cases are, it's where the virus is, and so they don't want to even come. They wait at home until they've run out of their medication. So our old clients are relapsing. Some are coming with comorbidities. Somebody that we were treating with depression will now come in with full-blown anxiety disorder. Some of them have had businesses breaking down, going down, and they begin to think. So somebody you were managing for maybe schizophrenia, and then now comes in with depression. So our mental health issues have been on the rise, both old cases and especially new cases. We are getting a lot of new cases altogether in this pandemic era.
The surge in cases is placing a strain on the already overstretched facilities and staff. Dr. Owusu, who is also Vice President of the Psychiatric Association of Ghana, sums up the frustration of caregivers.
We are honestly overwhelmed. As mental health workers, we know our limits, and so we've put ourselves into teams. But when you come on duty, you realize that it's really overwhelming. If it has not tripled, maybe quadrupled, because we now even have to deal with not just patients who have tested positive and have suddenly become anxious. You have to deal with their relatives. You have to deal with the healthcare provider. So if one person tests positive for COVID, there are about 4 others who suddenly start developing anxiety symptoms that you have to tackle immediately before it progresses into something more severe. And so the parents, siblings, they live with the spouse, the healthcare provider that took care of the person, all have to be brought to be seen at a goal. So our numbers are probably even quadrupling.
At the regional level, the Mental Health Directorate says mental health cases, including generalized anxiety, has gone up. Depression, which did not show in the first 5 cases in 2019, now sits third in the psychiatric cases recorded in the first quarter of 2020.
If you look at the figures as compared to 2019, you can see that the cases are increasing. Because in 2019, from January to June, we had 5,180 cases. That is new cases of mental illness. Then in 2020, from January to April, we have 4,022 new cases. So you can see that we have 2 more months to end up with the half year. But if you compare the figure to the 2019, January to June, you can see that this figure is a bit higher.
Experts warn the number of COVID-19 related mental illness could quadruple in the coming months. The situation calls for immediate attention. From Kumasi, for Joy News, Ohimenteria reporting.
Now, let's go into the phone lines now and speak to a psychologist on this. Dr. Ruth Owusu-Entry is the head of the psychiatric unit at the Komfo-Anokye Teaching Hospital, and she joins us. Hello, madam. Thank you very much for your time here on Newsdesk. Rather worrying situation that we are seeing in Kumasi. I wonder if you have a fair knowledge of what is happening nationwide, because you are in touch with your colleagues elsewhere.
Yes, good morning, Roland. Good morning to your
Ernest here.
listeners. Ernest, good morning, Ernest.
Yes.
I am sure that this is not a rise that is just limited to Kumasi. I have not specifically taken numbers from my colleagues, but
Definitely.
the general impression is that even within the country and beyond the country, there has been a general increase, especially in anxiety disorders, that we can directly relate to this COVID-19 pandemic.
Would you say the lack of education, so to speak, is partly to blame for what we are witnessing in Kumasi especially?
I think education is going on, but we should do more. When you look at the entire pandemic and how it is being tackled, mental health has been relegated to the background. WHO recommends that as part of the treatment, people who are affected should be given psychosocial support. When some of these issues are implemented, even at the national level, it triggers down to every district, every region, which will diagnose patients with COVID-19 and give them psychosocial support right from the beginning. And because that aspect, the psychosocial aspect, the mental health aspect is being left out, we are getting more people getting anxious. As far as I am aware, some centers are doing very well in terms of the psychosocial support, in terms of the mental health aspects of this pandemic. But some people either are not doing it or they don't even have the expertise to do it. And I think that it's about time the government involved mental health aspects in this whole pandemic.
And yes, can you make the points, please? Hello, madam.
Yes.
Yes. So I was saying that especially with young people, I mean, when you look at the statistics and the figures we're recording, it tells you that quite a number of the people who are testing positive are young people. Could that also be another reason why we are seeing such disorders, psychological issues with young people? Could that be a reason?
Well, I think the figures, the age range we are seeing in Kumasi does not reflect what is happening everywhere in the country. And I don't think the age is directly related to the incidence of mental conditions. The different mental conditions we have seen on the increase cuts across all age groups. The elderly are afraid as well as the young people. When you take young people, for instance, their lack of information or enough or adequate information about mental health issues is probably what may land them in mental conditions like anxiety and depression as a result of the pandemic. And when I say that, then it's because we have not done enough education about COVID. We are doing some, but I think it is not enough.
For people who already have issues, mental health issues, conditions that they are receiving treatment for or going through therapy, whatever it is, how would you recommend that they conduct themselves within this period, and especially for people around them, parents, siblings and guardians, people who are taking care of them? What would be the advice to such people?
Our advice to those who already have a diagnosis of mental condition and are receiving care to be consistent and compliant with their treatment. When it is time for review, some people miss their appointment just because they are afraid to even come to the hospital setting. They miss their review, then they run out of medication. Before you realize, they relapse. There are other people who, out of the anxiety that comes with this pandemic, are resorting to wrong means of coping, wrong coping mechanisms like taking in excessive alcohol and substances of abuse. We are also encouraging people that anytime they feel overly anxious, they should contact their healthcare providers or their mental health care providers. And then again, for the entire country and the people in the community they live with, stigma has become one of the big issues we have to deal with as part of this pandemic. If people do not feel stigmatized again, then the fear will be taken away, which will ripple down to stable mental health. It will take away the anxiety that goes with the condition. And so everybody has a part to play in all of this.
Thank you very much. That is Dr. Ruth Osuentri. She is head of the psychiatric unit at the Komfo-Anokye Teaching Hospital, bringing us some more perspective on the issue of psychological and mental health issues associated with COVID-19.